Eighteen minutes to the top of the hour. Welcome back to the Morning Drill on Stream Television, Armstrong, and the Allegheny News Talk Sports Network. Joining us this morning, our friends from Titusville Area Hospital. Holli Wolfe joins us, and Holli, you brought in a special guest this morning.
I did. I have Dr. Rogers with me. He's our general surgeon at Titusville Area Hospital. He's been with the hospital for 5 going on 6 years. We're very fortunate to have him with us. He was actually voted this year best surgeon, best doctor in the oil region by our friends at the Titusville Herald by the poll that they did this summer. So we're very lucky to have him.
Well, good morning. Thanks for joining us this morning.
Good morning. Thank you for having me.
Yeah, let's learn a little bit about yourself. Where are you from?
I'm West Indian by birth, born in St. Kitts, St. Christopher. Moved to the United States in 1979, New York. Did my medical school there at SUNY Downstate, and finished my residency at Harrisburg Hospital in Pennsylvania.
Now, at what age did you know that this is the profession you wanted to get into?
I was 11.
11?
Yes.
Yeah.
Very nice. Now, did you think at 11 that you just wanted to be a doctor or
Surgeon.
Surgeon?
Yep.
So you knew and that was it?
I knew, and that was it. Yes.
Yeah. Well, how you enjoying Pennsylvania?
I love Pennsylvania.
The seasons? You enjoy the seasons?
I was in the Midwest for a period of time, and the ability to see mountains is welcomed.
Nice change of pace, huh?
Yeah, the state is amazingly beautiful. The seasons are, I think, exaggerated. The flora, the fauna, it's just beautiful. There's really little other words to use to express the feeling I get when I'm here.
Yeah. In terms of your practice, I'm sure every day is the same, but every day is different. Is that what makes it challenging for you?
What makes it challenging for me is, I guess, the approach I use toward my patients. Some people I have heard refer to their patients as family or friends. I refer to my patients as me, what I would expect done if I were the patient. And I think if you apply that quality across the board to all patients, then you're going to have more success, and you're going to win more cases. We're not perfect. We don't win all the time. But I think if you approach each patient that way, they're going to get your best effort every time.
Are people surprised by that approach? Are they a little taken back when you first say to them, this is what I would do?
I think they are impressed that I'm a person. And not just a technician, that I care. And I think that's a big selling point in my practice, that they realize relatively quickly that I actually care and would like them to have the same feeling toward their health.
Now, Holli, I'm sure for you, that's a great thing to hear, that's the kind of approach that people are receiving when they step into the hospital. That's the kind of care they're going to have when they check in. Absolutely.
And I always say Titusville Hospital really makes my job easy because it's the people, at Titusville Area Hospital. I always hear wonderful things about Dr. Rogers and, and lots of the other physicians at the hospital. So truly, they are what makes Titusville Hospital great and makes my job easy to promote them.
Yeah.
Yeah.
Well, so the patients that you're seeing, obviously they're coming in for different reasons.
Yes.
Is part of what you do, part of that challenge is trying to figure out the problem-solving aspect of it?
Back in training, in medical school and residency, you're taught the technical aspects of medicine. You develop an art or skill or technique in identifying how to approach each patient the way you need to get them on your side. On your side does not mean agreeing with you. It means understanding they should be part of the healthcare team also. Mm-hmm. And so I think you have to talk to, communicate, and more importantly, listen to your patient so that you can get them to see what you're trying to do for them. And what you're really trying to do for them is to arm them in the battle against their illness. And for that, you have to educate them, and you have to convince them that it's a fight they can win. They just need to try.
Well, they have to open up, right? I mean, how many times does a patient sit there and they're holding back because maybe they're afraid to say what exactly is wrong?
Well, I don't want to generalize, but I believe the majority of the times that is encountered is they're afraid of what I'm going to say, what I'm going to find. Yeah. They're afraid of the news. I only consider it bad news if you don't know what it is. I consider it weapons in your battle if you do know your enemy. The illness does not have intelligence, no brain. It has one purpose: injure, hurt you, and eventually kill you. Your job is to find out what it is and educate your patients so they can best predict, identify, and defend against it. With colon cancer, it's like termites. It sits in the wall, eats the house. You come home, open the door, and the whole thing falls down. When you develop a symptom, it's usually not a good sign. And so we have to surveil, we have to monitor, we have to screen. And the algorithms are extremely complicated and change almost monthly. But for the patient, I find the simplest approach is to educate them. Tell them what they're dealing with, win their trust, earn it. And then I think you have a better fight in the battle. And so I teach my patients. I